All right. Welcome, everyone. I'm Rob May, co-founder and CEO of Neurometric.
And I'm Ryan Eppley, co-founder and CEO of Root Access.
I'm Anna Kirk. I'm sales lead at Thread AI.
And this is the AI and NYC show.
And tonight we have a very special guest. We have Carrie Hodge from Dimer Health joining us, CEO. Carrie, do you want to give yourself a quick introduction?
Sure. I'm Carrie Hodge, CEO and co-founder of Dimer Health. And we are a service-enabled tech company where we are bridging that gap between the discharge and the follow-up with really personalized, proactive, AI-driven care.
Cool. And how does you have an app, or you have a widget, or you make how do people use your product?
Yeah, so we have an app, but we also have medical practice. It's a virtual medical practice. So our patients can reach us and interact with us really anyway. But our AI is, we call her Amy, and she's through our app and tied into the patient's medical record. So when a patient has a question, they can engage with Amy and we'll get personalized recommendations and feedback based off of their actual medical record.
And so was AI a factor in you starting this? Did you see these trends and say, this is something we have to go do because AI is a possibility now? Or this is a separate idea and you went down that path and were like, oh, and we should use AI because that's what everybody's doing?
You want the story?
Yeah.
All right. The story. So my background is I'm a clinician. So I spent most of my career in emergency medicine and clinical leadership on a national level. And during COVID, I had this profound moment where we were triaging ventilators to get to hospitals across the country through the company I worked with, and laying off or furloughing our emergency providers. And people were staying, because our volumes were down, because people were staying home instead of going to the hospital, and then dying at home of heart attacks and strokes. And it blew my mind that we could get something from Amazon in 2 days, and we couldn't get basic healthcare to people where they were at when they needed it. And I took a leap into the startup world at that time and did a lot of work across the country where I was looking at ED diversion and readmission avoidance and operationalizing these projects where we got really great results. And it became so abundantly clear that we could absolutely change healthcare by filling the gap here. And the only way to get it to the people that need it the most was scaling it with technology and putting it into their hands. One of my co-founders at the time, he had a tech background, exited and retired back in 2013, and ended up on a pathway where he got his EMT and paramedic, and then went to PA school and was working in one of the ERs I was overseeing. And he got his doctorate in using AI and technology to reduce ED recidivism. So we reconnected and were like, with my skills, your skills, we are going to solve this problem. So AI was always a part of it, and technology to really bring care to people where they were at, when and where they wanted it, was always at the forefront.
Carrie, talk to us a little bit about kind of the trust barrier that you might have to overcome with some of your customers, kind of when they're getting to know how to use your product, when they're getting comfortable with Amy versus, talking in person to a healthcare professional, what that might look like.
Yeah, I think it's a really interesting dynamic with information and healthcare and trust, because in healthcare, it's extremely vulnerable, it's extremely personal, and I think in general, people want to be treated as in a 4-dimensional way. They're not an algorithm of yes or no. They're more, the status of health is way more complicated than that. But I will say, we haven't had an issue with people not wanting to sign a consent or not want to utilize Amy because of the AI. They mostly love it. And they say stuff back to us like, I didn't know healthcare could be like this. Wow. Yeah, it's really amazing. I think I actually find the issue with information about patient information a bigger concern for health systems, not necessarily individual patients.
So whenever I get to meet founders that name their AI, walk us through, how do you land on Amy? Why? Was there an art? Was there a science? Was it a gut check? I just think Amy's the right name for us. How did you come up with the name Amy for your AI?
Well, I will not take credit for it. Our national medical director, Dr. Zhang, came up with it, so I want to give him full credit. But the name just worked because it's AI, me, and we're tying the information that Amy gives to people back to their personal, most vulnerable information.
Got it. Okay.
So I liked it.
Okay.
So we did it.
So you've been working on an AI company for a little while now in the New York ecosystem. Have you got plugged in at all? How do you feel about the AI ecosystem in New York? Are you off on your own and not aware of much going on, or do you feel like this is a good place to do a thing like this? Has it been easy to find talent? Like, how do you feel about the ecosystem?
So I will say I am on the other side of the river. So maybe I'm not the ultimate best person to ask about this, but I haven't been super plugged into the community. I have gone to like a few different events and met some people. I would love for that to be like more accessible, because I think sometimes the journey of a founder is a lonely one and it's hard.
We'll have to shoot a show from Jersey sometime.
Yeah,
Just
guys,
'cause it's-
come over.
You get the whole view of the New York skyline. That's the whole
Yeah.
pitch, right?
Yeah.
Yeah, going more into like your technology as a differentiation from, I've even used ChatGPT to ask random things like, hey, like I'm feeling this way, right? I'm sure you've gotten the benchmarking or the feedback from customers. Like, how have you really gone about building a better health and wellness AI agent, app, however the product is kind of framed for you versus the traditional out-of-the-box LLM? Like, how do you really feel the differentiation is for your company?
I mean, I think ultimately, was it GPT Health just came out, which is, I think, amazing. And I love that people's information and the conversations and information that's important for them to have is closer to their fingertips. And that I think we've been using this word a lot actually in the company. There's an inevitability to all of this. Like the AI is becoming so good, it's evolving so fast that it's going to be relevant to people. I think the thing that we do differently is that we train our models to escalate to a clinician when appropriate, and we review all of the models. So there's checks and balances, and also we're catching those subtleties that might exist if maybe the AI gets it wrong, or it's too conservative, and it's not able to see nuance. So I think that's a huge differentiator for us.
Maybe on that note, I'd love to kind of hear in terms of how a typical user might interact with your platform, how they might interact with Amy. Like, I'm a patient who was just discharged. What would my kind of journey look like?
So I'll give you like a typical journey with us, and then what a conversation might look like with Amy. How's that? So you get discharged. We receive a ping that you got discharged, and all of your records and the information that we need for you is at our fingertips. We reach out to you almost immediately, and you're on a video visit with a physician, an MP or a PA, within usually 24 hours of your discharge. And so at that point, that's like the starting point, where from there we risk stratify you in terms of your likelihood to have complications. And that's getting better and better with the data analytics that we do. And then we create a journey for you. And part of that journey is downloading our app and having Amy, where you can ask questions, and multiple check-ins and subsequent appointments. And we're available for text and questions 24/7. If you were, let's say you were discharged for something and you have a headache, and you might say to Amy, like, hey, Amy, or hey, doctor, I have a headache and I want to take Advil for it. Amy will say, I'm looking at your medical record. It looks like you take Eliquis, which is a blood thinner, and Advil is contraindicated in that. Let's get some more information on this headache. And then you might give some more information. And at that point, the AI will say, let's hook you in immediately with a provider to have a live visit with a doctor, or if it's basic common medical information, it'll just tell you what to do.
So Amy is mainly kind of the frontline, like level 1 triage, and then it's escalated to a healthcare provider.
Yeah.
Recommendation.
Although I look at it like, maybe this is a terrible analogy, I don't know, but I look at it like, like in a have you ever seen bullfights? They've got like the multiple gates that the bulls come through. Like I look at AI as like the bull and is ready to go. And the gates are like all the rules and regs that are still out there. But like when it's time, I do think that AI will be doing the clinical visit as well. And I think that's coming faster than we think.
Wow. And so how do you feel about, going back to sort of like the ChatGPT Health thing, which just launched, and there have been a lot of different perspectives on it. Some people have said like, oh, this is great. It democratizes access to medical stuff. Other people would say it gives hypochondriacs another thing to be worried about, or it's going to put too many health resources and personal information in the hands of one company. Do you worry about any of these other criticisms?
I mean, maybe this is a blasphemous thing to say, and I hope they don't kick us out of network, but I think much of our health information that's out there is already in the hands of one company. So I think like that fear is probably misplaced right now. So yeah, so for that, I think that, and maybe it does give hypochondriacs something else to worry about, or maybe it'll like assuage some of their concerns. Though I will say, like, one of our head of AI, her daughter was sick and, with a stomach bug, and she was like playing between the different platforms. And she had said at one point, she looks a little bit yellow to me. And it was like a very alarmist reaction from the AI. So I think like it still needs training. It needs to get better. And I think subtleties and nuance are really hard right now for these things to catch. So we'll see. I mean, but I think it is the step in the right direction. And I think these things are learning very quickly.
Would you guys use it? Would you put your information in? Are you going to use ChatGPT Health? Anybody not going to use it?
I guess I'm not as like guarded with it. I don't know. Maybe I should be after hearing kind of like opinions on it. But I feel like I'd never ask anything too sensitive. I say like, how do I get rid of this cold a little faster other than saltwater gargles? What else I got up my sleeve kind of thing? I'd Google that though. So it's not like I would put anything different into Google that I would ChatGPT right now.
Yeah, exactly. I was just about to say that. Like my status quo today is, I'm going to look this up on WebMD, which is arguably much more trustworthy than just whatever ChatGPT spits out. But I think where I do, I'm pretty like blasé with my information. Maybe I shouldn't advertise that, but I think where I have questions is around like, concept drift, and like LLMs are notoriously bad about maintaining memory at a high fidelity over time. Doctors who can look at a physical chart, maybe they are too, and it's just a little bit more buried. But I'm so curious kind of to hear your perspective, Carrie, on like, do you think if an LLM is dealing with patient history that dates back, 6, 10, 12 years, what that kind of journey looks like versus you're pinging ChatGPT Health and you're like, hey, I have a question about the common cold. Like those feel like very different kind of use cases to me.
Yeah, and I think that's actually a great point, because even in regular medicine, like you could go into an ER and urgent care to get like a quick one and done thing taken care of. But if you have a complex medical history, like most people eventually do, you want to have all of that accessible for the decisions that will be made about your health. So just one more note on the ChatGPT Health. I think it's going to be really interesting when it ties into the wearables and all of that data, and how that data is going to be able to recognize trends and early intervention to things. And then in terms of making decisions, I'll tell you, as a clinician, like if I have a patient that has a really, really complicated medical history and they've had 10 hospitalizations in the last few years, and they've got a diagnosis list of 20 different diagnoses and a med list that like goes from the floor to the ceiling, to prep for that visit and then do a good visit on that patient where you're having a meaningful interaction and able to like access objective information, and then take all of that, like cognitively process through it and come out with a good decision. You have 5 clinicians doing that, you're going to get 5 different opinions on how that outcome should be, probably all in the same ballpark. So I think like the way using the AI to condense all of that into something where you can get the important information in front of the clinician or in front of the AI clinician, I think it actually will help with mistakes.
It almost like in my mind brings up this thing that happens of like malpractice, right? And lawsuits with that. Is there like an insurance policy that like AI is taking when it comes to giving out information about like remedies or what to do? Because I'm sure all practices have some form of medical malpractice liability insurance, right? Like walk us through how you think about that as a technology company.
Well, we also have medical malpractice because we're also a medical practice. So we do have that.
Is that under like the same umbrella? Is the insurance company like aware it's under the same umbrella? Like, yeah, how does that work? That's actually very fascinating to me.
So our AI doesn't make clinical decisions. And that's what the laws say now. AI cannot make clinical decisions. Although, what state was it in that was Utah. Yeah. They just came out with an AI that refills medications, which is making a clinical decision because, I could go off on a tangent about this, but so right now the laws are pretty clear that AI cannot make clinical decisions. So I look at like AI right now as just like another person, like another member of the team, like sitting at the table with us. I think once AI starts to make clinical decisions, it'll be really interesting to see what happens with the malpractice and the insurance. I mean, I'm sure it won't be perfect, but I think the way to really assess how good it is to look at complication rates with actual humans versus the AI. So yeah. I don't think it exists yet though.
Yeah, I have to imagine that's like a market being made though, right? Like how do people insure against like wrong information from AI agents? I have heard about that in other industries, but not in health yet.
Yeah, there was a company here. I think they pivoted, but there was a company in Brooklyn that did that for robotics, and they basically initially just outsourced there was another insurance provider, and they were a front end for it and gathered the data. And they were trying to build the data set on if I deploy a humanoid robot in your house and it
knocks over something.
Yeah, set your house on fire or what? Are you going to sue the robot company or what are you going to do? And so, but I guess they pivoted. That might have been a tough market. Could just be early. Typically for those insurance businesses, you have to have. So my first company was a cloud backup business, right? We did backup for Gmail and Salesforce and stuff like that. And people would say like, well, I'm moving to the cloud, so I don't have to do that. Doesn't Google take care of that? And you're like, well, they do. But if Marion Accounting deletes your Google Doc, like you can't get it back, right? Google's going to delete it from their servers and everything else. And so we would have to rely, like we didn't take off until there were like some big incidences of cloud data loss.
And there have been some big instances, like OpenAI has had a pretty public, horrible.
Yeah, with the people that discuss suicide with it, yeah.
And that's another question too, like the inherent nature of ChatGPT being people-pleasing. Like what does that do when you need to give very candid medical direction that is not what the patient wants to hear?
Yeah, how did you system prompt Amy's personality? Like who is Amy? Like what do they feel like? I'm sure whether you're making that decision or your team's coming up with that decision, like how did you give personality to your AI agent?
So Amy right now doesn't have a ton of personality. So like I'll say that. And
I kind of almost want that from my like healthcare provider.
Do you want that from your healthcare provider?
Yeah,
I've met people like Amy.
Yeah.
Though I do think there's something there. Like the best doctor is going to be the one that you listen to, right? Like, and so if you can deliver care to people in a way they can hear it best, I mean, I think that just goes with any sort of leadership role too. But yeah, I think if Amy can morph, which she doesn't do yet, if she can morph and speak language and inference and have cultural sensitivity and language level and all of that, that's right for the patient, that factors in their social determinants and their medical history and all of the information we can put in on someone, I like that is really exciting to me. I have no doubt that we'll be there. But right now Amy's pretty boring.
Yeah.
She's kind of new.
How do you guys, any of you guys, how do you think AI and medicine are going to start to intertwine as, let's say medicine is fragmenting in terms of, because part of what you got from like social media and people able to do their own research and all that kind of stuff is you have a bunch of anti-vaxxers now, and then you have like the highest, I think, death rate from measles that we've had in 40 or 50 years or something like that. And so what advice does Amy, or like would Amy get, like, how do you treat that you might have to give advice like your kid needs the measles vaccine, and people are like, no, just that category of questions, like how are those going to be handled in AI, these AI related things?
I mean, I think there is standard of care, and that's what we are defaulting to with Amy. So there's like the medical standards that people are trained on, that you're taught on. So, that kind of cuts out all of that noise. Although I do think that, I think a great example of this is some of the studies that were done on women in hormone replacement therapy and menopause. Like, they're finding now that those really weren't representative studies, and actually they led the practice of medicine somewhat awry for many years to us poor women. And I think AI will be able to really help help with the data analytics that come in, and then give scientifically sound insights.
I'm so curious, and I hate, stop me if I'm going on too much of a tangent here, but your point, Rob, made me think a lot about there's medical care and how it's delivered, but then there's also how people receive it. And I know from personal experience, I know from kind of talking to some of the medical professionals, I know you have to, in some ways, kind of angle your advice towards who you are talking to. If you are talking to a 25-year-old who doesn't go to the doctor very much, may or may not kind of follow your advice, and maybe you need to catastrophize a little bit more to make them take it seriously. I'm curious if that's something that you foresee Amy doing. Is that something that you think is necessary to deliver some of this medical guidance?
Oh, that's like a whole psychology.
We're kind of misanthropic on patients as a right?
Well, humanity is messy, so.
Well, and it's also if you are conducting any kind of science and you are assuming that your subjects will adhere to that 100% of the time, you're probably not being pragmatic about how you're delivering that.
Yeah, I think that's an interesting point, because medicine is a partnership between the provider and the patient. And so that information has to flow back and forth in a way that's meaningful. And I mean, not every clinician is great either, right? And they don't always listen. And, I think I think actually in my view of what's going to happen in medicine is, and if you guys are not in healthcare, you probably haven't heard this, but those that have, we talk a lot about working at the top of license and utilizing resources under the most expensive resource optimally so that we can decrease costs without compromising quality. And I think that, you might, I have this wonderful endocrinologist, and I had this virtual visit with her, and it was 3 minutes long. And, because she's going. And the workload on doctors is so burdensome. To chart appropriately is a lot. And this will take off a lot of that not valuable work that AI or a less expensive resource could take care of, and hopefully elevate people to top of license so that you've got higher expectations for the clinicians to deliver really better care, oversee some of the AI that's going to be emerging, and have more capacity to give more meaningful time with people.
It's on the other side of medicine, if you will, but it's something that I see almost every week. A new AI startup is about drug discovery, right? Have you interacted with some of these founders, or do you have a take on what's going on with drug discovery and AI? Because I feel there's got to be at least 4 or 5 in just New York alone that have raised pretty sizable rounds, and they're AI for new drug discovery.
Yeah, that's definitely not my expertise at all, but I do think that changing how we treat disease in healthcare has traditionally been a very long process. And the research could even come out and the resources come out, and it takes 20 years to actually have that adopted into actual regular practice. And I think this is going to really accelerate who is going to be right for which drugs and who's going to have the most optimal outcomes. And I think some of the stuff that is people way smarter than me are discovering is using AI algorithms to direct mitochondria to, do X, Y, and Z, which there's a founder that I met who's a brilliant guy. He he figured out a way to use AI to tell cells to regenerate muscle for muscular dystrophy.
Wow.
And like it could cure the disease, which is amazing. Like, so that's about all I know, but it's, I think, really exciting.
I mean, according to my Instagram feed, you don't need things like that because red light therapy fixes everything.
Everything.
So it's like, I see it for like every part of your body is there's a red light thing and it'll fix whatever problem you have, which seems a little crazy to me.
Yeah, you have another prompt for your AI generated image.
Yeah.
Speaking of which, you want to get into that story?
Yeah. So one of the pieces of news we want to talk about is, Grok launched a new Grok with a K. So we for those of you, let's just clarify. There's two Groks in the AI world. Grok with a Q is a piece of hardware. NVIDIA bought that company recently, so you're going to hear about that in the news. Grok with a K is the AI that's behind X.AI, Elon Musk, and all that kind of stuff. So Grok with a K launched a new image tool that apparently was generating so many inappropriate, unapproved nudes of people per minute. And it spawned a law in Wisconsin to prevent AI deepfakes of people. And it spawned a bunch of, backlash against Grok. And then a bunch of other people sort of don't care. So, I mean, how do you guys feel as like average citizens that somebody could generate a nude of you and put it out everywhere? And
I mean, that's a good question. Like my immediate reaction is probably not the best one, which is like, well, it's not actually real. So like, but how do they know that? Like what kind of, and how is this law in Wisconsin going to be enforced?
There's definitely laws for like name and likeness though.
Yeah.
So there is some type of like precedence for how the law
and there's
this.
revenge porn laws,
right?
Which are also kind of like related. So these probably all tie together somehow.
And I know they're both at the state, federal. I don't even know if they're at local as well, but I think there is like policies in place to handle this. I just think the amount and how easy it is has just changed the game. And now it's like, okay, well, if it's not a full nude, is that still like against it, right? We were joking before the show about, generating you in a bikini, right? Like that's what people are doing on the timeline now.
That's what people
right?
want.
Yeah, and the red light mask, right? Like someone's gonna do that. I know our followers will.
There we go.
Send us some photos, please.
We'll see that on LinkedIn tomorrow. But I feel like there is policies in place for name and likeness to prevent this. It's just, what's actually going to be done, right? Because people can create an account, do that really quickly. And then
I think your point, the scale is the problem, right?
Yeah.
It's like when you enable this kind of scale, the tools can't keep up. When it's small scale, you can do enforcement one-off and have paperwork and whatever that process is, but otherwise it's hard.
And it puts the burden on the victim or whoever kind of was targeted of making sure that's enforced. And when you're doing that at a massive scale, like how do you quantify that damage?
Yeah. I think they're going to need legislation at a high level. It's the only way to deal with it.
I thought it was really interesting, Elon Musk's reaction to it. It was like, well, it's not the technology that's the problem. It's the people prompting the technology that's the problem. And I almost think of it like behavior is really strange. Like when you're driving, people have this, it's even, I think I saw an Instagram thing where someone was like, if you treated walking down the sidewalk like people treat driving in their car, and they're like, slow down, and like giving the person the finger, and it's almost like there's this barrier of like no one sees me, so I can like say whatever I want. And I agree with you that there's going to have to be some sort of consequences, because to Elon's point, like it isn't the technology, but there is, I think at some point, some moral barriers.
Yeah, I think we've talked about this on the show before, but I was an electrical engineering major in college, and in the engineering department, if you're a civil engineering major and you're building bridges and buildings and whatever, you're required to take ethics courses because they don't want you to let's skip on the concrete and save some money because the people die. We never had to take an ethics course. Computer scientists didn't have to take an ethics course. And so, we used to joke in the early 2010s that like all the best and brightest computer scientists in the world were at Google and Facebook trying to get you to click on more ads. Is that really how they should be spending their time? And like, no, there's been a lot of arguments if social media is good or bad. The people that built those things never really asked the question, right? Or thought much about it. And there's not an easy answer to a lot of these questions morally and ethically, but we didn't have those discussions. And so I think that's a problem. I think it needs to start at the education side, which is like, hey, if you're going to go out and build these things, you do need to have a perspective. And I think Elon's perspective is a little bit naive. I mean, I had that when I was younger in tech. I was like, well, tech's neutral and it's how you use it, but some tech lends itself better to bad usage, and tech is overly obsessed with lowering the friction to do everything. And sometimes the friction is good, right? When you used to have to write a letter to the editor instead of just tweet, a lot of people gave up, right? Or weren't going to do it. And now that you can tweet, you can just say every dumb thing that comes to your mind. And that's probably not good. They're filters for a reason. Friction can be a good thing. And so I'm not on Elon's side.
So we think we'll see more legislation pop up pretty quickly about this?
I don't know pretty quickly. Tech has become a huge lobbyist against legislation, and the current people that are sort of in charge of the AI side, in the Trump White House, are sort of very anti any legislation. You'd probably see it out of Europe first. I think Europe's led the way on most data privacy and AI related things, so that's where I would expect to see it. And then America will follow suit at some point. They'll have to, but even like the revenge porn stuff, a lot of that happened when I was in college. And you had the first time that you could post, digital nudes of old partners online and stuff like that. And so that started to be an issue. And that took a long time to fix. Probably like a decade. I knew a guy when I was in Louisville, the guy who started ReputationDefender.com. That was actually sort of the original use case, was to be able to go automate and send out like takedown notices of things like that. Yeah. Other news we've got. Yann LeCun from Meta, who's their sort of AI scientist and also one of the fathers of, neural networks. A lot of people don't know, but he worked on neural networks all through the 80s and 90s when people thought it was a stupid technology and was not going to go anywhere. And he was eventually vindicated. And we've made a lot of progress in the last 10 years because of neural networks, 15 years. And he has now been saying for a couple of years, like, it's capping out and we need to move to something else. So he's left to start a company. I forget what it's called, but it's building world models. And the thing about world models is they use what's called JEPA, which is like joint embeddings for something. I don't know, but embeddings in AI, for the viewers, are like you take something and you convert it to a space that computers can understand. So they're converting like physics and things about the world to a space computers can understand. So you can put that in these models as well, and they won't do things or give answers that might violate common sense or physical principles or anything like that. I actually saw the deck for that deal, and they're raising $500 million just to get started, which is pretty crazy. But I mean, he's kind of the godfather of all this kind of stuff. And this is going to be good for New York too, because he splits his time between Paris and New York because he was here for the Meta office.
I'm so curious, and maybe you know more about this than I do, Rob. Like, what are the logistics of actually training a world model? Like, I think so Gary Marcus's opinion article that he posted this week, which is why it's relevant this week, was around kind of the story behind Yann LeCun leaving, but then also kind of what makes sense in the context of like, should we have like models that are grounded in a physical and logical representation, or should we have models like we do currently that are a little bit more symbolic and look to words and images and symbols? And he likened it to basically like either if you're a baby and you're learning how to crawl, you need to like touch your physical environment and figure out what gravity feels like in order to be able to do that. You need to fall a couple times. Whereas like we're not built to follow these statistical representations that are basically just like a corpus of different words. Like what goes into training something like that?
Well, I mean,
like it seems like it would be expensive, I guess is my point.
So this goes back to like the decades old like Noam Chomsky versus everybody else debate about how the human brain works, right? Yeah. Which is like, are we born through the years? Have we evolved some set of expectations about how the world works that we're born with, and are we not? And some things they know, they test things. We can like if you drop a bunch of things right in front of a baby and then you do some kind of trick where you drop something and it suspends, you see if the baby's surprised. And that tells you if they understand dropping, right? Because they can't speak. So they do this at children. They run weird tests like this of children of different ages to try to understand what they know and at what age. My favorite one they do, just as a side note, is they'll put a dot on the kid's head and put them in front of a mirror, and they'll see like it's like a dirt, right? Ashes. And they'll try to see if the kid wipes it off the other kid or if they realize it's on them. And that sort of tells them when they get a sense of self that like, I'm the one in the mirror, it's on me. So they do a bunch of things like that. So I don't know the answer to that. My guess is what it sounds like from what I know about JEPA is it's probably going to be trained with backpropagation in sort of like similar ways. Maybe there's more reinforcement learning somehow, but you could hard code some of this stuff in. You could use these RL gyms, I think they call them sometimes GYM, right? Which is like a place where you can train, use reinforcement learning to train models to do different things. They've had a lot of success in video games, but it's hard to define objective functions outside of video games in the real world. Particularly because humans respond to things on such different time scales. There's an immediate, like I touch something that's hot. There's intermediate times. There's things that we have long-term goals that are a year or multi-year. And so how you get feedback is very different. So I don't know.
It's interesting you brought up the gaming thing because, growing up, I played a lot of video games, and those worlds that they like create takes artists, 3, 4, 5 years, right? Even like, that's why the joke online is like, we'll get back to the moon before the next Grand Theft Auto comes out. Because creating the entire Grand Theft Auto, world is a lot of artwork and details about the physics of how a character runs into the wall and they'll stop, how a car drives around. That's all physics-based, game development. Just last week, though, on X, I saw someone live prompt an entire world within one prompt, and it was generated within 1 hour, and they could run a character around in like a game developer environment. So we're at the spot where like LLMs are being trained good enough to build games that have physics-based reality. To your point, how does it translate into like the physical world? That's why NVIDIA spent all that money on Omniverse. They're going all in on this. So if Jensen, one of the leaders in the space, believes in it, I don't know if it's a year out or 5 years out, but it's definitely coming.
Yeah, I mean, they're raising a lot of money probably to do the training. So we'll see. But I didn't see, at least in the deck, they didn't have any even clear plan what they're going to use them for. It's like,
that's my question. Like, as someone who's not as well versed in this particular area, like, what is the application for this, and what like. Words can only get you so far, or so I hear, but then what comes after that?
Got to be robotics. That's physical intelligence. It's how do you give open-ended, non-deterministic prompts to a robot and it actually performs accurately in the real world? Because right now there's all this like, oh wow, look at what this humanoid robot did, but it's teleoperated almost every time they do a live demo. The reason why is because it's really hard to pick up even like a bottle of water without having all the coordinates down to like the parabola of like, hey, this is like the y-axis, x-axis, z-axis that your arm moves. Like doing that with an actuator in a robot is really hard without doing it step by step.
Can we get one of the humanoid, is there a humanoid robot company in New York? Can we get them to give us a humanoid for one of these shows who sits here and we ask it to do stuff while we're...
There was one in New York, but I don't know if they're still around.
All right.
I don't know.
We'll see. That would be fun.
That'll be our task for the week.
We have a couple more articles to talk about, but Carrie, is there anything that worries you about AI? Like just, you're kind of working on the space and you see some of it, and obviously you seem pretty pro the healthcare things, but are there use cases in, self-driving cars or other things where you're like, that worries me, it worries me for society, or like I would never use it, or are you pretty excited?
I think overall I'm pretty excited, just like non-healthcare related. I think without checks and balances and news and image creation and social media, like to me, that's a little worrisome, just the spread of information and what's correct and what's not. And the difficulty telling the difference between the two. But overall, like, in what we're building, I think, the information in is so important to get good information coming out. And like what we're building, we're really thinking about like making sure that we're collecting clean data as we're, talking to patients and, putting it into their charts. And now that's going to be part of what's forever for them. And so making sure that that part's good so that when we have information that comes out, those recommendations, the real recommendations that are relevant. Even like there's a really cool company that the barriers really are the FDA laws, but they take vital signs just by doing the face scan, the same face scan that unlocks your phone. And it gets your blood pressure, your pulse ox, like really good objective data. You don't even like need to be in person with someone anymore unless you need a procedure done. So I think that I'm really excited about that.
How is that even possible? Like, are they doing that through like
vibes?
Just vibes alone?
Your pulse right now is Yeah, I don't know. There's got to be some underlying technology that's not really. It can take your heart rate just by looking at you.
Yeah. I thought the blood pressure was maybe not 100% accurate, but the pulse ox and the heart rate were really good. Yeah.
Yeah, a lot of it was down to the quality. I mean, there's been a virtuous cycle too, where the sensors have gotten a lot better over the last decade, because as people, as you have these devices like Fitbit and Whoop and all the other things out there, their suppliers, they go back to it and they say, we need something now with a higher level of tolerance, and they're, then that expands the market, and now it makes more sense for the supplier to invest research in, well, how do we make a better, I don't know, however they measure these things, on your blood vessels with lasers, red light. I mean, just put a red light thing.
Back to red light. Robin is
your
red
blood
light,
as it goes through. I don't know. Yeah. What else do we have here? Maybe last thing to talk about. Did anybody do a review of some of the stuff that's going on at CES? Because if you didn't, the most interesting thing, I mean, I watch CNBC every day. It's like my favorite channel, and I particularly in the morning. And they were talking a lot about for a lot of years, it seemed like CES was dead as a conference. Like, it was there, but like people didn't go. There was nothing novel. Consumer electronics were sort of new phones and all that. And then AI's revitalized it with robotics and everything else. But there was a lot of talk this year about enterprise AI, and CES was hot again. And that, I think tying back to the New York thing, I mean, enterprise AI, I think is going to be great for New York, because
so many enterprises here, right?
Yeah. I mean, this is where so many of the Fortune 500 are headquartered, and this is, like we've always said, sort of the applied AI capital of the world. So I think it's the place you want to be to do some of that. So I think CES was a good, bellwether for where this might go.
You take any notes on what's going on right now? Because the only things I've taken from is robotics based.
On CES?
Mm-hmm.
A lot of talk of world models also. That was very prevalent, especially with Yann LeCun leaving. That, and then enterprise AI. I mean, I think the question is, people know that enterprises need to adopt some type of AI technology. I think now we're just getting to a point where everyone is experiencing so much overwhelm around tool sprawl, and where do I start, and how do I not lose sight of the tangible business outcomes that have to come from this technology. And because I have a mandate around I'm head of AI, that means I need to deploy this technology. No, but you also need to use it to accomplish real tangible business outcomes. And how do you not lose sight of that?
I mean, I could tell you, so at Neurometric, we work with a lot of companies because we work at their inference layer, right? So we talk to people that are here's what I'm using AI for. Here's what I'm trying to, I have this data. Here's what I'm trying to do with it. I'm running it through these models. And then is it too slow? Is it too expensive? Is it not accurate enough, or whatever? I think one of the things that's interesting about the state of AI, per your comment about the problems people are having, this time last year, I think the markets were really excited about AI and everything that was coming out, but the companies were struggling, right? So we've talked about the MIT paper that 95% of these AI projects fail. Well, I mean, that paper came out in the fall. That data was collected in the summer from projects from the spring, whatever. So this time last year, lots of stuff was failing. And I think there was this big disconnect where the markets were like, AI, this is awesome. And companies are like, we can't get it to work. Now I feel like it's actually the reverse, where people are like, man, I don't know, is AI a bubble or whatever? But what I'm seeing inside companies is people having real use cases that over 2024 and 2025, they really figured out.
Well, I think they found where it could be profitable.
Yeah.
Even if it wasn't great. That's why there's so many call center AI startups, customer service ones, because it costs a lot of money to hire a bunch of people to sit on phones all day. But if AI can do a decent enough job, it's a huge cost center that a lot of these places are trying to figure out how to reduce costs in. So I think enterprises started figuring out where can even a okay model work to save my company money. I think that's found out through all these 95% failure rates. But then they said, okay, this 5%, we're going to dump a bunch of money in. I think that's what's happened.
Yeah, that makes sense.
I think the question is going to be what is a dreaded edge case, and how do we control for that and put guardrails around that in an area where we can't afford to get this wrong. And that's something we talk a lot about at Thread is AI is an important part of a workflow. It is not the entire workflow. So how do you craft a technology around your business processes? If you need to pause for human in the loop intervention, how do you make sure that AI can accommodate that versus managing all of these different point solutions, across customer service, across you want to use Copilot, but you also want to use glean, like how do all those systems work together, and how do you make them speak together in a way that people in your organization can understand? Because it's also like it's a process problem, it's a behavioral momentum problem.
So we didn't cover this because it was it happened after we shot our last show of 2025. But Ethan Mollick, who's at Wharton, published a blog post called "The Shape of AI: Jaggedness, Bottlenecks, and Salience," and he talks a lot about where it's getting applied and why, and where it's not. And so so note to our producer Maddie to like link to that in the show notes. That's a good.
You
good
catching
read.
up with CES at all?
So I don't know much about CES, but I do think like in terms of how AI is being applied, I think you're spot on. And just in healthcare, it's scribes. So there were a ton of scribe companies. Totally. Yeah. But like, I remember, 10 years ago, seeing a patient in the ER and thinking, okay, I got to go back to the computer and then I got to go chart this and it's going to take me forever. And then, at that time it was like all the emojis were coming out. I'm like aging myself big time here. Sorry to like the world.
I had a name.
and I was like, people aren't even writing words anymore. And it's like all copy and paste and like getting the relevant information. Like, why are we still writing charts? Mm-hmm. And I mean, if only I had thought of that, like, the company back then. But yeah, so now like what we're looking to outsource is charting and call centers. So both of those things, AI.
Yeah, makes sense.
Pretty fault tolerant.
What I took from CES for sure is there was like a clip about, obviously Boston Dynamics has been a leader in robotics for years now, right? They're probably the first one when you thought about robotics 10 years ago, like, oh, they look at that demo video, but they were kind of quiet for the last like couple.
Yeah.
They haven't mentioned too much publicly until CES about their humanoid, and they re-emphasize that they've been doing robotics for over a decade now. And I think it was like kind of a side eye towards like Figure, who's raised at what now a $39 billion valuation and hasn't shipped one commercial product. They'll tell you they have, but they really haven't. If you ask a lot of the people insiders. And Boston Dynamics came out and said, no, we're like the real leader in robotics that have actually done this. We have all the expertise. And now we just made our first humanoid because it's ready. I just felt like there was like a little tea being kind of, sipped in the scenes of CES in that kind of space. That's what I picked up, at least. I don't know if you saw that on CNBC or not.
I didn't see that particular thing, but I have some friends at Boston Dynamics, and I know their position on humanoids for a long time has been hands aren't good enough, battery life is not good enough. All the demos are staged. They're pretty pragmatic about the robotics they build. Well, Carrie, thanks for coming on today. If people want to learn more about Dimer Health, what's your web address, or what should they do?
Yeah, they can just go to dimerhealth.com, DIMERHEALTH. And you can email us or call us. Everything's right there.
All right. And we always wrap up with a question about New York. So we forgot to send you this in advance, but maybe the question today for everybody is, what's your favorite New York dive bar? And I'll say the place I go sometimes down by NYU is Red Lion, because
Red Lion,
Red Lion and part of the reason I go there, I mean, it's pretty dingy, but this is a college bar, right? But they have live music every night of the year, 365 days a year. So, when it's too late and you should go home and you're like, where can we go? There's live music. And you're like, it's relatively easy to get to from the parts of the city I frequent. And so, we end up at Red Lion.
I have to say, I don't think this qualifies as a dive bar. It's too good. But Smithfield Hall on 25th between 6th and 7th. I used to live right next to it. The owner of that bar has coached me through breakups. Like, I would go for like every soccer game. They have the best burger in New York also. So I think this is actually, I've used this answer twice now, because I also think I used it for best New York burger, but it would have to be Smithfield. Yeah.
Of all the places, because there's got to be about 10,000 plus bars in New York, maybe more. That's also my favorite spot, because I'm a huge soccer fan.
I knew that because you're wearing.
That's where I watch the Euros. That's where I'll be watching the World Cup, and it is a blast. Even at 10 a.m., they will have it packed out for a Premier League game. I don't know if it's called a dive bar. It's
It's that's more like an upscale sports bar, maybe.
It's sticky on the floor though.
By New York standards, it's a dive bar, maybe.
Yeah.
Right?
Oh my God, this is like the worst question for me. I'm from New Jersey, and I'm from like rural New Jersey. So we anyway, and I'm also kind of boring. I'm not a drinker. So I would definitely take recommendations though for
totally
great mocktail places.
Carrie, maybe we can swap that question out for another the special one I have for you, which is you mentioned you at the beginning you had a lot of fun stories about
The ER?
about the ER. Do you have any
That are appropriate.
standouts or, well, appropriate? So we can always edit it out if it turns out.
No, it's very hard for you to be too inappropriate on this show.
Our marketing
That's
tagline.
Ryan.
One of the things I loved about the ER was that like people come in. I mean, I think in general, I love that there's like this intense vulnerability and trust that's like developed right away, and you get to help that person just in general. But I also really love doing procedures where a patient came in with a problem and then like they left with it fixed like really quickly. And so, you know, I'm not one to shy away from like gross things like pus and big wounds and stuff. I've seen a lot of the best and the worst of people, and really, so you know, as soon as you say like nothing is going to surprise me ever, something new comes in. But I feel like what story to tell? I think that
None of them.
That's okay.
It's a sign of a good story. Well,
yeah, I don't want to.
We'll tell it at Smithfield Pub.
yeah, there you go.
Great. Well, Carrie, thanks for coming on. For those of you listening or watching on YouTube, give us a rating, give us a thumbs up, give us a follow. If you know guests that should be on, let us know. Watch the old shows, and we'll see you next week.